Good day to everyone. Today's topic of discussion is edema. So, what is edema? A common people will refer to edema as a swelling. So, depending on, why do anybody develop a swelling? Swelling is because whenever there is a small blood vessels in our body, they leak, and then the fluid or the blood or blood products or blood serum is outside the area that is not supposed to be, such as in the subcutaneous plane, then we call it as a edema. So what edema, today when we talk about it, we'll talk about it in the phases as, so what is edema, depending on the sites or the locations, how do we name it? Secondly, what causes edema? What is, if one person has an edema, how do they feel? So which is what we call as the symptoms. And then we go into the treatment of edema. So edema, as I said, is a swelling in the, because of the small blood vessel leaking fluid into the surrounding tissue. So let us look at the names. Depending on the sites wherein you have a swelling, we name it as, for example, you have somebody has swelling only in their hands and legs. So it we call as a peripheral edema. And somebody having edema, the swelling only in their feet, which we call it as a pedal edema. So for everything, there's a different reason. We will tell you which ones cause edema where. Some patients will have sudden blindness. So that could be because of the swelling that has developed in the eyes. So that we call as a macular edema. Some people with electrolyte disturbances will have complaints like a headache, sudden onset of nausea, vomiting. All of this is because of the swelling in the brain, and that we call as a cerebral edema. Sometimes patients do develop complaints like breathing difficulty, which may start suddenly or it may have come up over a period of time. And this is because of the fluid accumulation in the lungs. That we call it as a pulmonary edema. So sometimes, rarely you go to a garden and some bee might have stung the person, and then you have a swelling locally. So the swelling, depending on the site that it is coming up, we'll call it as either pedal edema or a peripheral edema, wherein hands and legs is also involved, or we have the macular edema where the eyes, cerebral edema for the brain, and a local edema for a local sting or something, or it could be a lung edema, which is a pulmonary edema. So now that we know the names that we use for the swelling, let's go to the second step, which is what are the things that cause, what are the causes for the swelling or the edema. So that is again depending on the site. So for example, if you're talking about the cerebral edema, cerebral edema is in the conditions wherein there are some electrolyte disturbances like low sodium level. You can develop brain swelling. Suddenly, the sodium level is brought down from a very higher number of 148 to down to 135 or 120. Then also we do have a development of a swelling. A person who could be having a stroke or a bleeding in the brain, they can develop a brain swelling. So these are the causes for the brain swelling. Now, for the eye edema, which is a macular edema, it is because of the retinal blood vessels getting damaged in conditions like diabetes, hypertension, or retinal detachment. Other times when you have a blurring vision or macular edema. So what causes pulmonary edema, that is fluid in the lungs, is any patients who are having a heart problem, a heart condition. When the heart is unable to pump very well, then there is a back pressure and the fluid gets accumulated in the lung and they do develop edema in the lungs, causing breathing difficulty. Sometimes there could be a kidney patient who is not able to put out the fluid a lot. Then the heart is overloaded, and then because of the kidney, again the heart kind of goes into a failure, and then the fluid develops in the lung. Or in patients who have sometimes pneumonia, or they develop interstitial edema, or that means again fluid comes out of the blood vessels, leading on to the capillary leakage and swelling in the lungs. So pneumonias, such infections, blood vessel leakage problems like an ARDS, or in heart failure or a kidney failure patients will develop pulmonary edema, that is a lung swelling. Patients who develop only leg edema is in the early stages of any organ problems also, or it can also be because of the local causes. For somebody who is working long hours, not moving as much and sitting long hours with their feet dangling, the circulation, the blood circulation that is going to the feet, and then the veins are the ones that are supposed to pick up the blood from the legs and get it back to the heart. So if the person is sitting for long hours, the pumping action, the veins are very, uh, they need some amount, the muscles to be pumping the blood to move back. So if you're sitting for long and not moving the muscles, then naturally the muscles are not pumping the veins to push it up. So edema in the legs can develop without any real pathological problem. It can still be a physiological problem only. So sometimes varicose veins, wherein there is a valvular problems of the veins, because of which the fluid is not moving in upward direction as it is supposed to, because of the leakage backwards, then also a person can develop leg swelling. Sometimes people also have something called as a filariasis. In filariasis, what happens, the blood that is getting to the peripheries is coming back through the veins. However, the small amount that is also picked up by the lymphatics and brought back to the heart. In filariasis and other conditions, or lymphangitis, wherein the lymphatics get affected, this 10% of the fluid that is supposed to be coming back is unable to reach out to the heart, and that also causes the swelling of the extremities, especially the lower limbs. And but this type of an edema is different from that of a regular fluid developing because of the heart problem or a kidney problem, wherein there is just a fluid. That is what we describe it as a non-pitting edema. That means when you apply pressure for 30 seconds on the shin, if you develop a dimple, then that is a pitting edema. If it is not forming any dip, but then the swelling is there, that we call it as a non-pitting edema, which is because of the lymphatic blockage. So leg swelling can be because of the lymphatic leakage, or it can be because of the venous. So lymphatic one is because of the infective, or the lymph nodes getting blocked because of any malignancy, wherein the drain is not adequate, and then therefore so malignancies and infections will give you non-pitting edema. Venous edemas will give you a pitting swelling, and this thing can be physiological when person is not moving, or when they are sometimes they are, or they have the varicose veins. Um, Also, some medications, like some blood pressure medications, which are lowering the blood pressure by dilating the blood veins, they also will lead to the swelling in the legs. So it can be physiological, it can be pathological because of the problems, medical problems, or it could be because of the medications also. So that we need to understand why it is happening. Then coming to the other peripheral edema, when we talk about the swelling is so much that you can develop, hands also will have some swelling, legs also have swelling, and this is usually when we have a little bit more of fluid accumulated in the body in organ conditions such as heart problem, kidney problem, or liver problem. So these are the causes of the swelling in certain areas for which we call. Now let us go to the third part, that is what are the symptoms that a person will feel when they are having these types of edemas. So if the edema or a swelling is local and it is because of the insect bite, then they can have a small swelling that is localized only in that area, along with some pain, a stinging pain, and which is again going to be very, I mean, would have started acutely and the person would be recognizing it. If the person is having coming to the leg swellings can develop very gradually, and because of that they will also the heaviness is felt in the legs, because of which whenever they're walking they feel like they're carrying some weight, and sometimes they also feel numbness because of the stretching of the skin. And very rarely, when the fluid is more than what it is supposed to be, like a huge amount, and the stretching is so much, they can even have the water seeping through the skin. So that is one type of venous leg edema. In lymphatic edema, you might have already seen that as the lymphatics get blocked over a period of years, so very gradually the swelling and the skin becomes thick, and the swelling keeps on increasing, and the skin also becomes so rough and thick like an elephant skin. That is where elephantiasis name comes for the leg swelling because of the filaria. Okay, so then also again people feel like they're carrying like 10 kilos of weight along with them. Each time they lift their leg and put it forward, they feel like they're carrying the a heavy sandbag or something like that. That's one thing. Secondly, the sensation will get affected, and therefore infections become much more common. And because as the skin stretches, they'll also feel a little bit of itching. So this start scratching that will break the skin and then cause or lead them to develop cellulitis. That means infection getting into the body and causing this infection around the area of the scratching. So these are the complaints that they will have. That is a heaviness, sensation alteration, and then itching, because of which then later on they will develop cellulitis and other infections inside the body. People with heart failure will have problems with the breathing difficulty because the fluid is accumulating in the lungs. So initially, it might be that can develop suddenly or it can develop gradually. If it is developing gradually, usually they will have problems with activities. Later on, even at rest, they're also unable to lie down flat at night, and they suddenly wake up in the middle of the night seeking like, I need some air. So that is what we call as paroxysmal nocturnal dyspnea. That means only at night time they do have the problem when they are trying to lie down. And that is because of some pneumonia people. So the breathing difficulty is the main complaint that they will be having. People with sudden rise in the blood pressure, the eyes vision gets affected, and people who develop swelling in the brain, their main complaints would be headache, vision problems, nausea, vomiting, a little bit of a confusion, sometimes even fits or seizures. So these are the complaints with each area wherein the swelling develops. Now coming to the treatment, that is a fourth part of our understanding on the swelling or the edema. So how do we treat each one of this? Basically, treatment is based on the reason or the cause that is leading to the swelling. So if we are talking about the lymphatic edema from in the legs, so the cause is filariasis. Treatment of filariasis with antifilarial medications will help. So second is the venous edema. So usually we try, and venous edema is a pitting edema. So this is because of the fluid that is accumulating because of the venous pressure. So that is because of either the person is sitting for a very long time. So we ask them to keep moving, ask them not to be sitting for a very long time. Every 5 minutes you're working, get out, walk for 2 minutes and get back to your seat and start working. So when a person is walking, the calf muscles exercise, keep pushing the fluid into the mainstream when from the muscles area. So the swelling comes down. So that is asking them to move around a little bit more. Sometimes if their work or because of their condition, maybe they had a fracture that they're not able to get out or bear for walking for some time, then we can ask them to put some crepe bandage, or even the stockings come which can prevent them from developing swelling if they have to sit for very long hours. So symptomatically we can as the swelling comes down a little bit. Sometimes a lighter massage, which is like what we call as a milking action, and this can work for the venous as well as the lymphatic edema also. What this is meaning is that in a systematic manner, we go from below to the spine ascending order. So trying to push the fluid gently into the mainstream up towards the body. So that also can reduce the swelling. After that, if it is because of the medications like amlodipine or cilindipine, these kind of calcium channel blockers, which are known to cause a little bit of swelling in the legs, we probably reduce the dose of the medication. If we cannot reduce the dose and those medications are a must to control the blood pressure, then we can add certain other medications like diuretics, which will reduce the swelling. So this is the other way of handling it. And if it is not the medications, then is it because of some other problem like a heart failure or something? Again, we do have medications for the heart failure which can reduce the fluid accumulation in the body. Usually you take the help of diuretics, and through that the body fluids are put out, and thus the edema comes down. In addition to all of this, there are also some physiological conditions wherein body gets fluid accumulation, which is not necessarily a pathological factor. So those are, one of them is a pregnancy. During pregnancy, uh, usually weight gain is obvious, and the weight gain is usually because of the baby's weight and also the placental weight. And in addition to that, because of the hormones, blood vessels are slightly dilated, and because of that the blood volume goes up slightly. And also pregnant women, because of the pressure of the uterus on the veins, there is a little bit of a leg swelling that can be expected. This is physiological. Usually after delivery the swelling goes away, so nothing needs to be worried on that part, unless they develop hypertension or something else, which the obstetricians will be taking care of. In other conditions also, like a woman who is coming closer to her menstrual date, will also have certain amount of weight gain, usually not very significant in some of them, but some people it can go up to a kilo. They do develop the fluid retention because of the hormones happens, and that also makes them feel like, the tightness, breast tightness, and little bit of a swelling is expected. But after the menstrual cycle, as the hormones go away, the fluid also getting out of the body and the swelling disappears. So this is also physiological condition. So other than this, the other problems that I mentioned, which is the lymphatic edema from the filariasis, or because of the lymph node blockade, for which we actually go ahead and do the massaging or the diuretics, and medications are the other cause I mentioned. The third one is again the organic organ problems such as kidney failure. If the kidney has failed, then the treatment for the kidney initially is again medications, again with the help of certain medications to improve the kidney function, or the diuretics to put the fluid out. The last and not least is when the kidney function is completely down, we take the help of dialysis to remove the extra fluid from the body. Other than this, we have heart failure, again medications to improve the heart function, and to support the cardiac pumping, to take rid of the fluids. Again, we use the medications to put the fluid out of the body called as diuretics. Macular edema is usually handled again with the controlling of the problems such as hypertension or diabetes. Sometimes a laser treatment the ophthalmologist use to take control the bleeding part, again thus reduce the swelling in the eye. Brain edema is usually managed by the maintaining the electrolytes, maintaining the hypertension. We ensure that the BP is not dropped down suddenly in the stroke cases, which will increase the swelling. So we bring it down very gradually to ensure that the swelling is not progressing and further worsening the neurological damage. So this is how based on the cause of the swelling, the idea, what is the cause is given, clue is given by the location of the swelling. So the location gives us a clue, and the clue puts us to the cause, and the cause is what we treat, and that is how we treat the edema. So edema is something that is treatable, and usually the organ problems can be identified early. So once we identify early, we can prevent them from going into the failure. If they don't go into failure, we do not develop swelling. So it is always, there's a lot of preventive actions that can be taken. And common regular people One more thing with an edema we talk about is a salt retention. So if you're as long as the kidneys are working normally, even a normal, I mean, if you take a little bit of additional salt, it gets out of the body through the kidney. However, whenever the kidney function is little bit diminished or because of certain medications we are on, then the little bit of a higher salt that we take gets retained in the body, and that also salt retention retains fluid in the body, and that is how the swelling comes up. Another thing that I want to mention is also the painkillers. Most of that us do take painkillers like for a headache, for a joint pain, for a muscle ache, and we keep on taking them for a little longer period of time without taking doctor's advice. So what happens is these painkillers also have, like, especially one group of them, that is NSAID group, we call like Brufen, Voveron, and other common medications that naproxen that you take from over the counter. These medications also have a tendency to retain sodium and thus retain the edema, I mean, thus retain the fluid in the body, leading on to the edema. So salt control will help in patients. So don't take too much salt, but today's day don't take very low salt also. The way when we talk about taking a normal salt is avoid anything that has high salt, like pickles, papads, bakery items, biscuits, all of that. That can be stopped, but take normal salt in your diet, which is like for any other person. Making a fresh item will prevent you from taking or the need for a higher salt. So stick with the fresh items, freshly prepared food items which are homemade. So the salt intake will be adequate. Do not take any painkillers for a long time without the advice of the doctors. And keep moving, keep exercising, and if you have to sit for long hours, there's no other go, or you're unable to walk, then take the help of the stockings or even the gray bandage, or do a little bit of light massages from below to above, which is what we call milking action, to reduce the swelling. These are the in general uh, precautions that everybody can take. Then going on to the specific cause and treating of that specific cause, like whether it's a filaria, whether it's an infection, whether it's a heart failure, whether it's a kidney failure, whether it's a thyroid problems, all of that will be as per the cause. So this is how you can take care of the swelling and edema and be healthy. Take preventive actions. Do not take medications without doctor's advice too much. Have a good day.